See, these are the references. WHO manual, sperm functional testing by Dr. Ashok Agrawal, and this fertility sterility in general. First of all, we are talking about hypo-osmotic swelling test. But first, we'll discuss about sperm vitality assessment. What is sperm vitality assessment? This test helps us to find out if sperm are alive or dead by checking their outer membrane. Okay, so if the cell membrane is intact, sperm are alive. If sperm membrane is damaged, intact, alive. Okay, if sperm membrane is damaged, means sperm are dead. Okay. Now, when do we perform this test? When is the test not needed is if the motility is 40% or more, means sperms are 40% or more sperms are moving, then we don't need this sperm vitality test. Okay, it is needed if the sperm in the sample aren't moving much, and we need to figure out that are they alive but unable to move, or are they completely dead. Okay. Significance. What is the significance? If many sperms are alive but cannot move, it might be due to the tail defect. Okay, the tail of the sperm is defective, might be because of that sperm are alive but not moving. Okay, now, or if the most of the sperms are dead, it might mean there is an issue like problem with the epididymis. Problem with the, this is epididymis, na? This test is epididymis. So it might be due to the problem in the epididymis, or there may be some immunological reaction due to infection caused by the body to attack sperm. Some immunological, which is making the sperm dead, immunological which is caused by some infection, some epididymal defect, or some immunological action due to the infection. So these, because of these, sperm may be dead. There are other reasons also, but these are the main reasons. Then we'll talk about the methodology. Okay, there are two tests. Basically, there are two tests in sperm vitality test. Other tests also are there, but I'm talking about two tests here because I have to focus in hypo-osmotic swelling test. In this, I am focusing in hypo-osmotic swelling test. So I am talking about only two tests: dye exclusion test and hypo-osmotic swelling test. So that this dye, we check membrane using two type of test. Okay, dye exclusion test and this hypo-osmotic swelling test. The dye exclusion test, what does what happens in this test? Dead sperm let dye intern. If sperms are dead, they will let dye dead sperm. These are dead sperm. They cannot prevent, no, so they will enter the dye. They will let the dye enter and turn into red or pink. Can you see? See, these are red or pink sperms. So that means they are dead because they are letting this is dead, no? So there it is letting dye to enter in it. Okay. Some bad thing we won't, if we are alive, we won't let any bad thing enter into us. But if we are dead, any bad thing can enter into us. Okay. And alive sperms stay white or clear. If sperms are alive, okay, if sperms are alive, it will remain white or clear because they block dye to enter in it. See, stop. It is saying stop. Don't enter in it because it's an alive sperm. Okay. Now, what hyposmotic test? A sperm with intact membrane swell in hypo. This is about dye test. As we can see, this is live. See, this sperm is live. It is white, no? Head is white. So that means this one is live. This one is live. This one is live. Okay, white with white head. It is not letting dye enter in it. Then hypotonic swelling test. Sperm with intact membrane. Now we are talking about hypotonic swelling test. Is sperm with intact membrane, the sperm in which membrane is working. Okay. These are membrane is working. So it will maintain its osmolarity. So if osmolarity is maintained and if inside the membrane the osmolarity is more, see, I'll make more clear. This is sperm, okay? Osmolarity is more here. Solute osmolarity. Solute osmolarity is more here and it is maintaining that. So the water will enter inside. This sperm is alive. That's why it is able to maintain the solute osmolarity. Solute osmolarity is more inside the cell. So water is imbibing inside. That's why it is swelling. If it was dead sperm, solute osmolarity cannot be maintained. Okay. So water won't reach inside because there won't be any gradient, osmolarity gradient won't be there, so there won't be any water or there won't be any swelling. They won't the water would not reach inside the cell and there won't be any swelling. So basically sperm with intact membrane swell when placed in hypotonic solution. Once more I'll explain the dye exclusion test. It evaluates sperm viability by distinguish between live sperm and dead sperm based on their ability to exclude a dye. Okay, dead sperm will become red or deep pink head. Why? Because dye penetrate inside the sperm because their membrane is damaged. Dye penetrating inside because their membrane is damaged, allowing dye to stain the cell. But live spermatozoa sperm will be white or unstained head because the sperm have intact membrane which blocks the dye. Blocks dye, preventing it from entering the cell. Now, what is the principle? The principle of dye exclusion test is it works on the idea that only dead sperm allow dyes to enter the cell because their cell membrane is compromised. Okay, while live sperm exclude dye to enter the cell due to the intact membrane. Purpose of the study is this test is essential in fertility studies to assess the proportion of viable sperm in semen cell sample, aiding in understand sperm health and function. Okay, because some immotile sperm may be there, but we'll think that is dead. But by doing dye exclusion test, we can know no, it is alive. Okay, because the membrane is intact. Best to use for this purpose. Best to use is eosin negrosin test. Basically, test should be done as soon as possible after semen liquefy. Okay, ideally within 30 minutes, and we should never delay beyond 1 hour as sperm can dry out or there may be temperature shift, there may be damage to the sperm. This was in journal about vitality test. Okay, this was in journal about vitality test. Now we'll talk about particularly about hypo-osmotic swelling test, HOS test, hypo-osmotic swelling. What does this mean? Swelling of the sperm in hypo-osmotic solution. Hypo-osmotic solution. Okay. Now see what is I'll talk about the principle. See, what is there? Live sperm. We'll talk about live sperm. In live sperm, the cell membrane is intact. Cell membrane is intact and functional. Basically, HOS test tells about the functionality, and dye exclusion test about the intactness. Okay, HOS test tell about the functionality. So the specialized channels are actively functioning. So okay, these channels help maintain sperm balance of solute, means solute balance like ions inside the cell. These channels help in inside cell. These channel help in maintaining the solute balance. Okay. Now, when we place a hypotonic solution, low solute concentration outside the cell, water flow inside the sperm due to, see, this is low concentration solution, water flow inside the cell due to osmosis. Moving towards higher solute concentration, because inside the cell there is higher solute concentration. Okay, this one higher solute concentration, so water will flow inside the cell. This result in sperm swelling because the channels here was functioning. It was able to maintain solute concentration inside, so water flow inside the cell. So if there will be sperm swelling, that means the membrane is functional and sperm is alive. Now we'll talk about dead sperm. See, in dead sperm, cell membrane is damaged and the solute balance inside the cell is disrupted because the channel are no longer working. Without this internal solute maintenance, there is no internal solute maintenance, the cell cannot draw water cannot be drawn inside the cell because there is no osmosis even in the hypotonic solution. If we'll even keep the cell in hypotonic solution, there won't be any drawing of water. That means sperm is dead because it do not swell, making us easily we can easily distinguish between a dead sperm cell and a viable sperm cell. See, in a hypotonic medium, osmotic medium, water start to flow inside the sperm cell due to osmosis if the sperm is alive. So this process begin within 5 minutes. If sperm is with intact membrane and the sperm is functioning, membrane is functioning and there is live sperm, okay? But 5 minutes it will start, but stabilization will take over next 30 minutes. Swelling will complete and the sperm tail assume the stable shape. So it will be making it easier to observe under microscope. So for routine diagnostic purpose, we'll see under microscope after 30 minutes. But for therapeutic purposes, like medically assisted reproduction like ICSI, okay? Speed is critical because viable sperm need to be identified quickly for fertilization. A rapid 5-minute assessment is sufficient to identify live sperm without waiting for complete stabilization. We'll only wait for therapeutic purpose. If we want sperm for ICSI, we'll only wait for 5 minutes and we'll only wait for 5 minutes in therapeutic purposes. Okay. See, in ICSI, speed is critical to preserve sperm quality and maximize fertilization success. So, prolonging exposure to hypotonic solution can cause membrane damage, or there may be excessive swelling. So, there may be reduced motility and viability of the sperm. So, a quick 5-minute assessment minimizes the stress on the sperm and prevent overswelling and ensure a rapid selection of the sperm for injection, maintaining the optimal functionality. Okay. Now we'll talk about the preparation of the reagent. See, swelling solution. How is it made? Swelling solution. This solution is designed for routine diagnostic purpose to induce swelling in the live sperm. So how is it prepared? I'll talk about the therapeutic. For therapeutic, it is different. The hypotonic solution is made differently, and for routine diagnostic purpose, the hypoosmotic solution are made differently. So for routine, we are talking about the routine diagnostic purpose. Okay, in routine diagnostic purpose, we have to dissolve 0.735 gram sodium citrate dihydrate and 1.351 gram D-fructose in 100 ml purified water. And we have to divide this portion to 1 ml. We have to divide these into 1 ml portion, and we have to freeze we have to keep it in microcentrifuge tube, and we have to keep in it those centrifuge tube into freezer in -20 degrees Celsius for storage. The citrate in sodium citrate dihydrate helps create a hypotonic environment, while the fructose provide energy for the sperm viability. Okay. Now, when this is for routine diagnostic purpose, okay, we'll use a sodium citrate dihydrate and the fructose. But for the medically assisted reproduction, what we do is we need a gentle solution. Gentle solution is needed to preserve sperm quality. So how will we prepare? We'll dilute a standard culture media in sterile purified water. Sterile purified water in 1:1. This create mild hypotonic environment while maintaining the sperm natural condition for optimal fertilization outcome. Okay, now we'll talk about the procedure and scoring of hypoosmotic swelling test. Step-by-step process we'll talk about. See, first step is thawing the solution. We'll bring the solution that we have stored in this microcentrifuge tube, 1 ml we have stored. No, we'll bring that solution. We'll remove the frozen swelling solution from the storage. We'll mix it thoroughly before using to ensure all components are evenly distributed. Okay. Second step is warm 1 ml of solution for routine purpose or diluted medium. Again I am telling that diluted medium 1:1. Okay. This is for therapeutic purpose. And this is for routine purpose. This should be done in the microcentrifuge tube. Okay. This should be done in microcentrifuge tube at 37 degrees Celsius for 5 minutes. This solution should be warmed at 37 degrees Celsius for 5 minutes. This step is important because sperm need to be in a temperature that mimics the body condition for an accurate result. Okay. Then we have to prepare ejaculate. Mix the semen sample. We'll get a semen sample. We have to mix the semen sample thoroughly to ensure that sperm are evenly distributed. This prevent biased result from an uneven sample. Then we'll add ejaculate. How will we do that? We'll take 100 microliter, means 0.1 ml of semen, and add it to the swelling solution. That 1 ml swelling solution. We have to mix with the pipette gently, drawing the solution in and out. Then this step ensures that all sperm are exposed to hypotonic solution evenly. Okay. Now we'll have to incubate the mixture. We'll have to incubate mixture in 37 degrees Celsius, 5 minutes for therapeutic purpose. Like ICSI, and 30 minutes for diagnostic routine purpose. The shorter time for therapeutic purpose is critical because to avoid prolonged handling which can damage sperm, while the longer time for diagnostic ensure complete and accurate observation. Okay. Now we have to prepare a slide. We have to take from this what we have done. We have to take 10 microliter of liquid from the incubation solution, and we have to place it on a clean glass slide and cover it with the 22 millimeter into 22 millimeter cover slip. This step ensure the sample is flat and easy to observe under microscope. Okay. Now we have to prepare one replicate slide, another slide. Remix the semen sample and repeat the above step to create another slide. This provide a backup or a control slide. Okay, now we have to examine the slide. We have to examine the slide. We'll have to use phase contrast microscope. Add 200x to or 400x magnification. So we'll have to look for the unswollen sperm. That means dead sperm with damaged membrane, and swollen sperm, swollen cell. That means live sperm with intact membrane. We have to count at least 200 sperms per slide using a counter for precision. Okay, another counter slide is there. No, 2 slides were there. The swelling appears as coiling or folding of the sperm tail. This is sperm. Coiling or folding of the sperm tail, which indicates live sperm. See? Photo microscopy under phase contrast microscope of spermatozoa subjected to hypo-osmotic stress. See this swelling. Can you see this swelling? All this swelling. 50% of the tail folded, less than 50% folded, tail tip coiling. Now we'll have to evaluate and record. Next step is evaluate and record. We have to see at least 200 sperm per slide to minimize sampling error, and we will record the proportion of live sperm versus dead sperm. Another thing is, see, for preservation, for later use, we can preserve sperm for later analysis and fix them with formaldehyde. Formaldehyde 18.5%, 0.1 ml, or ethanol acetic acid, ethanol/acetic acid 3:1 mixture, so that we can see it later. Okay. See this test, HOS, hypo-osmolarity swelling test. This is a reproducible test as seen by studies. means it is a reliable test. Reliable test means its results are same. If even repeated, its results are same. So a study was done where it was seen, okay, that it is a reliable test. It is a reproducible test. Now scoring and identification. See, how to identify sperm type? We'll have to look for swollen spermatozoa. We'll have to look for coiling of tail or swelling, okay? How will we recognize a live spermatozoa if there is a swelling of tail? How will we recognize if no dead spermatozoa if there is no swelling of tail? Now, final evaluation is count both swollen live sperm and unswollen dead sperm to get a accurate result. Now we'll talk about the physiological aspect. See, again, it is talking about what is HOS test. I have already told, okay? It was introduced in 1987 to check the functional integrity of sperm membrane. Sperm with intact membrane swell while when placed in hypoosmotic condition, indicating they are alive and active. And why do sperm swell? Because inside the cell, osmolarity is higher than outside, creating osmotic pressure. Okay. So intact membrane allows controlled water flow because of the osmolarity, because water will enter inside, because the channel in the sperm cell is maintaining the solute concentration inside the cell. Okay. So this will happen. Now, comparison with the dye test, HOS test is for functional capacity and dye test is for structural integrity. Okay. HOS tells about the functioning of the this sperm membrane. Okay. Principle of the HOS test, basis of the test is water enter the sperm under hyposmotic condition, causing the tail to swell or curl. Now, importance is it tells about the functional membrane integrity, which is crucial for sperm motility, capacitation. Capacitation means getting sperm ready to fertilize, and fertilization. See, now we'll talk about HOS test as diagnostic tool. Normal is when more than equals to 60% HOS positive spermatozoa. Abnormal is less than 50% HOS positive spermatozoa. Equivocal is 50 to 59% HOS positive spermatozoa. Now, see, membrane role in fertility is the HOS test helps detect even minor membrane injuries, which might reduce fertilities. It even tell minor membrane injuries. Comparison we'll do with other tests. First, we'll compare with the dye exclusion test. See, initially HOS test was thought to measure sperm vitality like dye exclusion test. However, it shows only a very less correlation with the dye test, because correlation with the dye test. The difference lies in what each test evaluates. Okay, HOS test focuses on the membrane functionality, while dye exclusion evaluate the structural integrity, if structural is membrane is present or not, and functionality it is told by HOS test. Okay, now HOS test versus standard semen analysis. See, HOS tests are more reliable predictor of conception compared to standard semen analysis, and abnormal HOS results strongly indicate infertility even when other semen parameters are seems normal. Okay, now we'll see SPA and IVF. That means what is SPA? Sperm penetration assay and IVF correlation. There is high correlation between the HOS test and SPA, sperm penetration assay test. Means, see, we'll see if sperm is ready to penetrate ova or not. If it is ready to penetrate ova, HOS test will give better result. Okay, so these two tests correlate. And even it also correlate with IVF success. It is HOS is a strong predictor for IVF success and this test, Jonah-free hamster egg penetration test. Jonah-free hamster egg penetration test. Same, it is telling that see hamster egg. Now we'll see the capability of sperm to penetrate this Jonah-free hamster egg. So HOS test is correlating with the both IVF and Jonah-free hamster egg penetration test. Okay, now pregnancy and embryo viability. See, study shows that HOS test is excellent predictor of pregnancy in vivo and embryo implantation rates. Abnormal HOS test are linked to, if there is abnormal HOS test, it is linked to recurrent pregnancy loss. Okay. Now we'll talk about lab practices. See, if HOS test is done on container material using polystyrene or polypropylene containers, polystyrene and polypropylene containers, this can alter HOS response compared to glass container. Okay, means HOS test should be done on glass container, not in polystyrene or polypropylene container. Now lab procedure, common sperm processing method also impact the test result for hypo-osmotic swelling. Even if we'll do the HOS test after sperm processing, it will alter the result. Okay, now other application of the HOS test. What is the, see this laboratory, I have taken container material, polystyrene and polypropylene specimen container, alter HOS response compared to glass container. Laboratory procedure, common sperm procedure method influence HOS outcome. Even sperm processing method is influencing the hypo-osmotic swelling outcome. Other application, what is the other application? Okay, we know that it tells about the viability and functional integrity of sperm. What are the functional integrity of sperm? What other application it has? It also act as a cryo survival assessment. It used to evaluate sperm survival after cryopreservation. We'll see how much sperm survive after cryopreservation. Okay. Second is toxicity testing. It also used to assess the impact of environmental agent like pesticides and chemotherapeutic drugs on sperm. Third is contraceptive development. It helps screen potential spermicidal. Even it screens that we'll see if the contraceptive agents are potential of the contraceptive agent we can see with the HOS test. Okay, it helps screen the potential spermicidal compounds. Okay, potential, how much potential the spermicidal compound has. Then optimizing reproductive outcome. We know HOS based sperm selection improves success rate in ICSI and IVF. Now we'll talk about the impact of age, varicocele, second is varicocele and maturation marker. Okay, now see, as age increases, abnormality in HOS results also increases. That means age is impacting sperm viability. Okay, in a negative way. Okay, now varicocele negatively affect HOS result due to its impact on sperm quality. And what about the maturation marker? See, markers like carnitine and alpha glucosidase shows correlation with the maturation related defect. See, what are these maturation markers? These are the molecules or enzymes present in the seminal fluid that reflects the proper development and functionality of sperm as they mature in male reproductive system. First, we'll talk about the carnitine. That means HOS test also shows correlation with the maturation marker. HOS test, if there is problem with the maturation markers, HOS test will also be negatively impacted. So see, first we'll talk about the carnitine. This is found in high concentration in epididymis where sperm matures. Okay, what is the role of carnitine? Carnitine is a essential for sperm motility as it facilitates the transport of fatty acid into the mitochondria for energy production. What is the significance? Low carnitine level indicate potential defect in epididymal maturation, or there is energy deficit in sperm, which can deteriorate the sperm quality. Okay. Now, another maturation marker we talked about is alpha glucosidase. So it is an enzyme secreted by epididymis. This is an enzyme, alpha glucosidase. What is its role? It plays a part in the sperm membrane development and overall maturation. So low level are linked to epididymal dysfunction, which may affect the sperm motility and maturation. Okay, these are the sperm markers. So if there is deficiency in these maturation marker, HOS test also will negatively impact. Means these maturation marker are correlating with the HOS test. Now we'll talk about the HOS test classification. Type A is no tail swelling. Type B is swelling on the tip only. Swelling on the tip only. Type C is slight swelling along the tail. Okay, slight swelling along the tail. Type D and E is tail bends into a hairpin shape. Tails bend into the hairpin shape. Then type F is tail appears shortened and thickened. See, type F is tail appears shortened and thickened. Type G is swelling occurs along entire tail. See, swelling occurs along entire tail. Now see, HOS positive will include B to G. All these will be included in HOS swelling because there is swelling in some way. Okay. And variation in the swelling reflects sperm functional quality and nuclear quality. See, regular monitoring of the tail responses reveals diverse sperm population in the sample. There will be diverse sperm population in the sample. Now we'll talk about the studies. Okay, studies. First, we'll talk on the horse tail swelling. There are two important studies. First is by Basiri et al. And second is by Stranger et al. These two studies are there. First, we'll talk about the Basiri et al. Okay, the study compares different type of sperm tail swelling under hypo-osmotic conditions to identify the most competent sperm. What was the finding of the study? Tail type swelling B was identified. According to this, tail type swelling B. This compare different type of tail tip swelling. Tail tip swelling means B type was identified as the most competent sperm type. Sperm with this tail type swelling pattern shows better head morphology, lower DNA fragmentation test. There was lower DNA fragmentation. That means there was intact genetic material. Okay, fewer immaturity markers such as reduced protamine deficiency. reduced protamine deficiency. In these patients, protamine deficiency was less. Protamine is a protein for packaging of the sperm. So this was protamine deficiency was less in this sperm because we need protamine, okay, for sperm packaging, DNA packaging. And another thing is there was low level of apoptosis. How will we know that? How will we know that there is low level of apoptosis? By seeing annexin V expression. These sperms decreases or have less annexin V expression, meaning the sperm is less likely to undergo cell death. By Stranger et al., this study confirms the DNA competency of the sperm with tail tip swelling and its importance for fertility. What it shows is tail tip swelling shows, this is tail, no? Tail tip swelling shows stronger association with DNA fragmentation compared with compared to head vacuole, making it more reliable. This is HOS test. This is vacuole, seeing of the vacuole. Means if HOS test is negative, there will be more DNA fragmentation. It shows stronger association. HOS test shows, what does this mean? This means that HOS test is a earlier marker for membrane alteration. That means membrane alteration detected by HOS test occurred earlier than vacuole formation, providing it as a valuable early marker for sperm functionality and fertility. Now, correlation to sperm quality will, okay, type B and to F correlate with better fertility potential, but type A is a link to abnormalities. This we have already discussed. Now we'll discuss about application. Application. C. HOS test can identify viable sperm with intact membrane even if the sperm is non-motile. This is critical for selecting functional sperm for ICSI. For ICSI, okay? Where motility isn't always necessary. We don't need motility in the ICSI. Now, chromosomes, then we'll talk about, this was first point, chromosomal selection. See, the HOS test can pick out chromosomally balanced sperm in case where the patient has chromosomal abnormality. Example like reciprocal translocation, reciprocal translocation, or paracentric pericentric inversion, or Robertsian translocation. Okay. This is critical for, okay. Okay. Now, third point is competency of B positive sperm. There is one sperm called B positive sperm. Researchers like Ruin et al. Identify a sperm group of sperm called B positive sperm. Okay. What was the key trait of this sperm? The tail tip swelling has a tail to swelling ratio of greater than 20. These sperm are chromosomally balanced, have low DNA fragmentation, and exhibit stronger nuclear architecture. That means what it means is, see, if this is tail, this is swelling. If we think this tail is length is 200, suppose 200, and this swelling is 20, around 20, then we'll do 200 by 20 tail to swelling ratio. This is 10. That means it is not that good. B positive is when this ratio will come greater than 20. Okay, so these pumps are this, if the ratio comes greater than 20, these sperms are chromosomally balanced sperm with lower chromosomally balanced with lower DNA fragmentation and strong nuclear architecture. Another thing is, Fourth point is reduced aneuploidy. Sperm from type B, C, D have 17 times fewer aneuploidy cells compared to unselected sperm. Okay. Now, fifth point is predictive of nuclear quality. HOS positive sperms have superior nuclear integrity, meaning their DNA and chromosome are more organized and stable. So this is essential for successful fertilization. Now, why is this important? Because HOS test is a powerful tool because it does not just see the viability, but it helps select the best sperm for ICSI by identifying sperm with intact membrane, chromosomally balanced sperm, sperm with low DNA fragmentation and high genetic stability. This ensures that the highest chances of successful fertilization and healthy embryo in fertility treatment. Now we'll talk about the application. See, application in sperm selection. See, we use this method in ICSI. Okay, it facilitates selection of the viable sperm from a non-motile population using a HOS test in ICSI. This ensure a higher DNA integrity and chromosomally stable integrity, DNA competence or integrity, or chromosomally stable selected sperm. Okay. Then I have second point is application is high aneuploidy rate. This identifies sperms with balanced chromosomal content, particularly beneficial for any genetic disorder, like we have already talked. Third is non-motile sperm. Detect intact viable sperm even in the absence of motility. So it enhances the it ensures a successful fertilization, or it enhances the likelihood of successful fertilization. So conclusion, basically, the HOS test evaluate unique sperm quality beyond the conventional sperm analysis, offering a simple, cost-effective tool that predict poor outcome in IVF or natural fertilization, indicates infertility and reflect nuclear organization, supports advanced sperm selection in ICSI, cryosurvival monitoring, and even assessing toxic effect, and should be a standard in andrology laboratory for functional sperm evaluation. Basically, it is better than sperm analysis, and it is simple and cost effective, and it predicts the poor outcome in IVF and natural fertilization, and it even indicates infertility and reflect nuclear organization, if nuclear is intact or not. It support the advanced sperm selection in ICSI, and it also monitor the cryosurvival monitoring also is done by this, and it also assess the toxic effect, and should be the standard. It should be the standard andrology laboratory for functional sperm evaluation. Thank you.